You know, from time to time, we may joke about forgetting things as we get older, but many of us must learn to care for an older family member who's losing their mental faculties. Dr. Syed Arfin is here to talk about mental health as we age. He's an adult geropsychiatrist at Cone Health Outpatient Behavioral Center in Greensboro and a member of the Cone Health Medical Group. Good morning.
Good morning.
You know, we talk about some forgetfulness is pretty typical, isn't it?
Well, it's typical, but also it's very common to pick up the symptoms of the depression and anxiety symptoms in geriatric population. It's been estimated that more than 20 to 25% of population suffer some sort of symptoms of mental illness or symptom of mental disease. And most common is anxiety, depression, mood disorder, which means the bipolar disorder and depression, and psychosis and cognitive impairments.
So if you're talking about someone who suffers from anxiety, for example, give us some type of description of what that may be or what they may do.
So we're talking about the geriatric population, and we need to understand that these populations, sometimes they are not forward to describe their symptoms. So the loved one, caregiver, family member, neighbors, they need to look around and find out the symptoms that, you know, they are not sleeping well, their mood, their attitude change, they're crying more, they're not involved, they used to enjoy, like my grandma used to enjoy fishing, reading books, watching TV, watching sports, but he's not doing it anymore. So these are the symptoms are early signs of, you know, mental illness. So look for those symptoms and address those issues.
What about mood disorders like depression or bipolar? These are things that you really need to get professional help for, right?
Yes, I think that still we are in an age where dilemma of the mental illness is there. So it's first step, I will say, if you pick up those symptoms that the loved ones are not doing the great job, the first step I will probably talk to the primary care doctor first, because they're more comfortable to open up with them.
Right.
And then if they see their person's symptoms are really to the point that their cognitive and functional impairment is going downhill, then I think there are expertise, social professionals, social workers, therapists, caseworkers, psychiatrists, nurse practitioners. They can help to bring back their, you know, happiness back to their life.
Can some of the medications that older adults take?
Absolutely. So when we address that, okay, that patient is suffering from depression, anxiety, and mood disorder, then they are pharmacological, which means the medication, and some are non-pharmacological. Especially in this age, patient already taking a lot of medications, so we really want to make sure that if the medicine causing any problems, you know, because there are very common side effects. People take like cancer drugs, hepatitis C drugs, and a lot of, you know, other medication, antihypertensive medication can cause depression. So we really want to make sure that they are not causing that, you know, symptoms. And then get a professional help to see medication. There are very safe antidepressants now. We are really have a lot of medication now. But I think clinical opinion from a professional must be input at that time. And they are non-pharmacological, like a talk therapy. The different kind of therapies for depression and anxiety is called cognitive behavior therapy.
Right.
So supportive therapy, that really can help a lot of people though.
All right, that's so good.
Yes, Cone has a lot of team which consists of professionals, including the case manager, therapist, social workers, nurse practitioners, psychiatrists. So I think we can help them if somebody can pick up those symptoms though.
Definitely good information to have on this Friday morning. We appreciate it. If you want to get details on the services that can help you or a loved one, check out conehealth.com/aging. And for healthy lifestyle tools, resources, and classes for all walks of life, check out conehealth.com/wellness-matters.
House Call on Fox 8 is sponsored by Cone Health.